Hello, ladies and gentlemen, and welcome to the BetterLife-50plus travel magazine. Today I'm at ITB in Berlin, Germany, and ITB is the largest travel trade show in the world. I'm here at the Malaysia booth, and I'm sitting with Shobena from the Malaysia Healthcare Travel Council. Shobena is a vice president for public relations, and maybe you can tell us a little bit more about why somebody should fly half around the world to come to Malaysia and even get medical treatment there.
Hi Sabine. Why Malaysia? Well, first of all, Malaysia is a very regulated country where healthcare travel is promoted by the government themselves.
Really?
Yeah, and we are directly under the Ministry of Health, Malaysia. Although we promote private hospitals, the agency itself, or rather the council, Malaysia Healthcare Travel Council, was set up by the government solely to promote healthcare travel.
And how many tourists, healthcare tourists, on an average you have per year already?
Okay. Last year alone, we had more than 1 million healthcare travelers.
Oh, really?
Oh, yes.
And where do these people come from?
Majority of them come from the Asian countries, Indonesia, China, Myanmar, Vietnam, and we do see some from other countries as well, other parts of the world like Australia, New Zealand, even the United States, United Kingdom, and the Middle East. So why do they travel all the way, as you said, from half the world, halfway around the world, all the way to Malaysia? Simply because they can come, have an affordable treatment, which is of the highest quality, okay, and also still have enough money to do some sightseeing in our beautiful country.
So you save money on the treatment, and you have some more time to see the country and combine it with a vacation. And money-wise, we actually, targeting the clients from the United States. And, in our country we have excellent healthcare, but unfortunately at a very high cost. Maybe you can give us some comparison for some treatments, like, I don't want to nail you on the ground, but to give our audience a rough idea about, per se, a hip or knee replacement, what we're looking at.
For example, for a knee replacement, in the US, I think it'll cost you about 34,000 USD. And in Malaysia, you can get that done for about 4,000, 5,000 USD.
Imagine, ladies and gentlemen, that's quite some savings, and you don't have to loop your nest egg for a medical treatment over there. Plus, it's a beautiful, beautiful country, really worthwhile exploring. Now, Shobena, maybe you give us a little bit more background. MHTC, it's like it belongs to the government. What exactly you do for foreigners who come to Malaysia to get medical treatments? How do you support them, and what are your services?
First of all, the Malaysia Healthcare Travel Council is an agency set up by the Ministry of Health Malaysia, and we basically facilitate and promote healthcare travel. We we rather work with the government as well as the private sector to ensure that the seamless healthcare, the patients experience a seamless healthcare travel experience when they come and seek treatment in Malaysia. We work closely with the government. We work with the private hospitals. We also work with Tourism Malaysia, for example. So we give them a holistic care when they come here. From the time that they depart and they reach our airport, we also have things like the meet and greet services. We have our airport lounges where patients can come. We can greet them at the Aero Bridge, take them to our lounge to rest, while the pickup services from the hospitals or the hotels directly fetch the patients. They go for their treatment, get the treatment, come back, and then we can also facilitate them going back.
Shobena, thank you so much for sharing this with us, and thank you, my dear audience, for watching this. And yes, see you next time on this channel, BetterLife 50 Plus. Take care, stay healthy, and see you soon. Bye bye.